So 2 weeks from now, I will be recovering from surgery. It'll be my first day in the hospital post-op. Some of the things that I've been working on or dealing with the last few days is, for one, getting the shingles vaccine, because I didn't mention this before, but 15 days ago I had my very first shingles outbreak. It started on my shoulder blade and it went down my arm. I was on antiviral for a week, so it's healed up quite a bit, but there's still, I mean, you can still see that I had shingles there, and it's still pretty painful. So the surgeon's concerned and wants me to get the vaccine. I called a pharmacy nearby, and they were pretty much acting or relaying that I can't have it because I'm not 50 and I just had an outbreak and I have to wait a year. I explained to them the urgency and what was going on and how my surgeon wants me to have it, and they were supposed to call me back. I never heard back, so I called my primary physician. She said to check with my insurance company to see if they will cover it for me. If they cover it for me, the pharmacy definitely cannot turn me away. And they do cover it 100%. And FYI, the CDC states that there is no time frame to get the vaccine after an outbreak. It's all up to your physician. So today, later on today, I'm hoping that later on today I can run out and get my vaccine. The other thing that I've been working on is getting my therapy device. So the surgeon wants me to have the Aura Stretch Press. Originally he wanted the Therabite, but he feels that the Aura Stretch Press is more beneficial for my case. Insurance does not cover that. I was on the phone with my insurance company and with Cranio Rehab, which is where my surgeon sent the prescription for the therapy device. Cranio Rehab is very informative. They have a lot of devices and accessories and information out there. It seems to be the primary place to get the device. So I ended up paying $438 out of pocket, but that included, I ordered the jaw bra compression. There's a regular head wrap without compression that's about $20. The jaw bra was $40. So those are the two main things that I've been working on the last few days. So right now I'm continuing with my antibiotics, and I'm taking a lot of probiotics every day. I take different types of probiotics because I believe there's up to seven different strands of probiotics. I'm trying to cover the bases. I take a Whole Foods multivitamin, and that has probiotics in it. I'm also taking some gummies, and I'm taking the capsules, and I just take them throughout the day. And that seems to help a lot so far with my antibiotics. I started the antibiotics 5 days ago. So yesterday was the last day I could have any NSAIDs. So no more ibuprofen, no more Aleve. But I'm also going to just go ahead and stay away from Tylenol. I just want to make sure that my kidneys and my liver's cleaned out and functioning, you know, at full throttle, so that that in hopes that I'll heal faster or better and not have any other issues. So I think I have 2 more days of vitamin E and omega. I usually take those every day, but you have to stop them 10 days prior to surgery because it can cause you to bleed more. I guess it's some sort of blood thinner, or it can cause you to bleed more. That's all I know. So that's the update with me. Dealing with shingles, getting the vaccine, continuing with my antibiotics and probiotics, and getting my therapy device. I should get my therapy device in about a week, and when I get that, I will share that as well. I guess that's all I have today, and I will continue to share my journey. I plan on sharing in the near future some of the items that I am taking and I'm using, and what I plan on bringing with me to the hospital.